Hi, I have multiple sclerosis since 2008, and I have been on Tesabre, which I took from 2012 after I had a exacerbation, and I took that for 2 years as I was JC positive, so the numbers just kept rising. I couldn't see it. It was a wonderful treatment, but my doctors were paying attention and they saw that my index was going up more and more. So after 2 years, they took me off of that, and I had probably a 5 or 6 month clean out period of not having anything. Had my MRI, and I had active lesions, so that just told me that nothing, it was coming back slowly, and they wanted to give me a choice of either Galenia or Lemtrada, and I did a little bit of research. Inside I knew that Lemtrada was sort of a hot MS treatment and might actually be a smart MS treatment. So I went that route and had a couple of weeks, and then I went right into it. I had one pill, 2 pills that I had to take the night before. I had to take an antihistamine pill and my antivirus pill. So I don't have any more of the antihistamine, but this is the actual antivirus pill that I took each day of my treatment, once in the morning and then once in the evening. I would take it on my own at home, and I would also take an antihistamine pill. During my 5-day treatment, I would take one of these in the morning, one of these at night, and one antihistamine pill in the morning and an antihistamine pill at night. I don't have any box, or I can't even quite remember the name of the antihistamine, but after the 5 days I stopped taking the antihistamine, and I have to take one of these each day, morning and night, for 30 days, and that's it. I stopped with these, and these are antivirus, so I'm not sure. I'm pretty much staying inside. I'm not really, I poked my head out, I think 3 days post Lemtrada, because I needed to go to the grocery store just to look for a couple of things, and then I was back in. Reading all about people's experiences with this particular treatment, I feel I did quite well, and I'm quite fortunate, because on my 3rd day of treatment I had looked like a sunburn on my skin, very light, lasted for 2 days. It didn't actually bother me, and other than, as you can hear now, I'm a little, it sounds like I have a cold, but I don't have a cold. For probably 5 days post Lemtrada, I was just blowing my nose a lot, and I don't normally blow my nose that much. I was blowing my nose a lot, had no pain, had no sore throat, had no cough. It was just blowing my nose. So I don't really know what that means, but it never turned into anything. I wash my hands a lot. I drink a lot of water, and I try to stay as much as I can off of anything containing sugar, because that's just never a good situation. These are walnuts that I eat on a very regular basis. This is Norwegian, so this one you might not understand, or some people might understand. And it's unsalted, and it's basically raw walnuts. You can have as many of these. I did take a nutritionist course and study a lot on nuts, and these particular nuts, you can have as many as you can possibly, I mean, without going crazy on them. You can have a couple of handfuls of these and it's not going to have any effects on you. I snack on these a lot. Also, raw cashews. I have that, and macadamia nuts. They sell them all at the grocery store. I'm very, very grateful. Probably almonds too. I'm not that much into almonds. I was when I was first diagnosed with MS. I just did only nuts, and I have no specific diet that I stick to. Right now, I'm just trying to keep off of sugar, because that really doesn't have a place in my life and in my future, and it's the hardest thing that I've ever had to give up in my life. So that's what I would suggest. And if you're lucky enough to not have any side effects or anything like that, that's wonderful and great. I have tremors. I've had them since 2012, actually since my first treatment. I remember when I got them. I don't know if you can see. I can't pick up very fine items. So for me, in my crocheting or knitting, even sewing and trying to get a needle in a thread into the needle is very difficult. I've heard that I have to be patient, and not everything is going to work right away with Lemtrada, and that's just wonderful. I am trying to be patient, but it is something, and really the only thing that truly makes me feel and look like I have some kind of issue. Most people think I might have Parkinson's, which I don't. It is just tremors that are part of my life, and I might have them forever, so I know how to operate and work around that. As you can see, I try to sit down a lot more than I should sit down, because I can steady myself if I'm sitting. I don't have my head moving and my neck moving. Everything does. I do have full body tremors, so even though I'm managing to make this video, it's not easy, and it makes things very tiring, exhausting. I'm not tired. I have not been tired through my infusions. I'm not tired at all, but I get exhausted, and I think people with MS do know the difference between being tired and being exhausted, and the exhaustion is something that will make me have to sit down quite soon. And when I finish this video, will make me want to sit down, or things do start to hurt. My legs will start to stiffen up, and cooking is one of the big ones too. I cook all day, but at the end of the day, I'm really, really exhausted. I'm not tired. I'm just like fatigued, and that's a tough one. That's a tough one. But yeah. So this is my post Lemtrada video, and I do plan on making another one after 2 or 3 months, maybe. I'm going for my first blood and urine backup. They've already booked it for, I think, April 27th. So at the end of this month, I'll be getting the check to find out if my immune system is doing anything, if it's starting over, if it's on its way. Right now, I don't have an immune system, so I will just continue to wash my hands. And yeah, that's it. Thank you.